1. Introduction. Mood disorders encompass a variety of conditions where the primary feature is a disturbance in mood. These disorders are prevalent across the globe, affecting individuals of all ages, genders, and cultural backgrounds. Mood disorders can range from minor episodes of sadness or irritability to severe, life-threatening conditions. Understanding mood disorders is crucial for developing effective treatments and supporting those affected by these conditions. 2. Types of mood disorders. Major depressive disorder, MDD. Major depressive disorder, often referred to as depression, is characterized by persistent feelings of sadness, hopelessness, and a lack of interest or pleasure in nearly all activities. Individuals with MDD may also experience changes in appetite, sleep disturbances, fatigue, difficulty concentrating, and thoughts of death or suicide. MDD is one of the most common and debilitating mental health conditions. Bipolar disorder. Bipolar disorder is characterized by alternating periods of depression and mania or hypomania. During depressive episodes, individuals experience symptoms similar to MDD. Manic episodes involve elevated mood, increased energy, reduced need for sleep, grandiosity, and impulsive behaviors. Hypomania is a milder form of mania that does not cause significant impairment in functioning. Bipolar disorder is subdivided into bipolar I and bipolar II, based on the severity and nature of manic episodes. Persistent depressive disorder, dysthymia. Persistent depressive disorder, also known as dysthymia, is a chronic form of depression lasting for at least 2 years. Individuals with dysthymia experience a generally low mood, with symptoms less severe than those of MDD but more enduring. This condition often goes undiagnosed as individuals may perceive their prolonged low mood as a normal aspect of life. Cyclothymic disorder. Cyclothymic disorder is characterized by chronic fluctuating moods involving periods of hypomanic symptoms and periods of depressive symptoms. The symptoms are not as severe as those found in bipolar disorder but are more persistent, lasting for at least 2 years. Cyclothymic disorder can significantly impact an individual's life, leading to disruptions in relationships and work. Seasonal affective disorder, SAD. Seasonal affective disorder is a subtype of depression that occurs at specific times of the year, usually in the winter months when there is less natural sunlight. Symptoms include low energy, overeating, weight gain, and craving carbohydrates. Light therapy, psychotherapy, and medication are commonly used treatments for SAD. Disruptive mood dysregulation disorder, DMDD. Disruptive mood dysregulation disorder, typically diagnosed in children and adolescents, is characterized by severe temper outbursts that are disproportionate to the situation and a persistently irritable or angry mood. DMDD was introduced to address concerns about the overdiagnosis and treatment of bipolar disorder in young people. Premenstrual dysphoric disorder, PMDD. Premenstrual dysphoric disorder is a severe form of premenstrual syndrome, PMS, characterized by significant mood disturbances, irritability, depression, and anxiety in the week or two before menstruation. The symptoms are severe enough to interfere with daily life and relationships. PMDD affects a smaller percentage of women compared to PMS but can be extremely debilitating. 3. Symptoms of mood disorders. Emotional symptoms. Mood disorders primarily affect an individual's emotional state. Common emotional symptoms include persistent sadness, hopelessness, irritability, and feelings of emptiness. Individuals may also experience anhedonia, which is the loss of interest or pleasure in activities they once enjoyed. Physical symptoms. Physical symptoms often accompany mood disorders. These can include changes in appetite and weight, sleep disturbances, insomnia or hypersomnia, fatigue, and psychomotor agitation or retardation. Chronic pain and other unexplained physical complaints are also common. Cognitive symptoms. Mood disorders can significantly impact cognitive functions. Individuals may experience difficulty concentrating, making decisions, and remembering things. Negative thinking patterns, such as pervasive guilt or worthlessness, are also common. Behavioral symptoms. Behavioral changes are frequently observed in individuals with mood disorders. These can include withdrawal from social activities, reduced ability to function at work or school, and neglect of personal care. In severe cases, individuals may engage in self-harm or suicidal behaviors. 4. Causes and risk factors. Biological factors. Biological factors play a significant role in the development of mood disorders. Neurotransmitter imbalances, particularly involving serotonin, norepinephrine, and dopamine, are implicated in depression and bipolar disorder. Brain structure and function abnormalities, such as changes in the prefrontal cortex and hippocampus, have also been observed. Genetic factors. Genetics contribute to the risk of developing mood disorders. Family studies indicate a higher prevalence of mood disorders among first-degree relatives of affected individuals. Twin studies suggest that genetic factors account for a significant portion of the variance in susceptibility to mood disorders, particularly in bipolar disorder. Environmental factors. Environmental stressors, such as trauma, loss, and chronic stress, are known to trigger or exacerbate mood disorders. Early life experiences, including childhood abuse and neglect, are particularly influential. Social and economic factors, such as poverty and lack of support systems, also play a role. Psychological factors. Psychological factors, including personality traits and cognitive patterns, contribute to mood disorders. Individuals with a tendency towards negative thinking, low self-esteem, and perfectionism are at higher risk. Psychological theories, such as cognitive behavioral models, emphasize the role of maladaptive thinking patterns in the development and maintenance of mood disorders. 5. Diagnosis and assessment. Clinical interviews. Diagnosis of mood disorders typically involves comprehensive clinical interviews conducted by mental health professionals. These interviews assess the individual's history, symptoms, and functioning. Standardized diagnostic criteria, such as those outlined in the DSM-5 or ICD-10, are used to ensure accurate diagnosis. Psychological assessments. Psychological assessments, including self-report questionnaires and clinician-administered scales, are used to quantify the severity of symptoms and monitor treatment progress. Commonly used assessments include the Beck Depression Inventory, BDI, Hamilton Depression Rating Scale, HDRS, and Mood Disorder Questionnaire, MDQ. Medical examinations. Medical examinations are important to rule out physical conditions that may mimic mood disorders, such as thyroid disorders or neurological conditions. Blood tests, imaging studies, and other medical evaluations may be conducted as part of the diagnostic process. Differential diagnosis. Differential diagnosis involves distinguishing mood disorders from other mental health conditions that may present with similar symptoms. Conditions such as anxiety disorders, personality disorders, and substance use disorders must be considered and ruled out to ensure accurate diagnosis and treatment. 6. Treatment approaches. Psychotherapy. Psychotherapy, or talk therapy, is a cornerstone of treatment for mood disorders. Cognitive behavioral therapy, CBT, is particularly effective, focusing on identifying and changing negative thought patterns and behaviors. Other therapeutic approaches include interpersonal therapy, IPT, dialectical behavior therapy, DBT, and psychodynamic therapy. Pharmacotherapy. Pharmacotherapy involves the use of medications to manage mood disorders. Antidepressants, such as selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, are commonly prescribed for depression. Mood stabilizers, such as lithium and anticonvulsants, are used to treat bipolar disorder. Antipsychotic medications may also be used, particularly in cases involving severe symptoms or psychosis. Lifestyle modifications. Lifestyle modifications can significantly improve symptoms of mood disorders. Regular physical exercise, a balanced diet, adequate sleep, and stress management techniques are important components of treatment. Social support and engaging in meaningful activities also contribute to recovery. Alternative therapies. Alternative therapies, such as mindfulness meditation, yoga, acupuncture, and herbal supplements, are increasingly used to complement conventional treatments. While some alternative therapies have shown promise in managing mood disorders, it is important important to approach them with caution and under the guidance of a healthcare professional. 7. Impact on individuals. Daily functioning. Mood disorders can severely impact an individual's ability to function in daily life. Symptoms such as fatigue, lack of motivation, and difficulty concentrating can interfere with completing tasks and fulfilling responsibilities. This often leads to decreased productivity and challenges in managing personal and professional commitments. Relationships. Mood disorders can strain relationships with family, friends, and colleagues. The emotional instability and changes in behavior associated with these conditions can lead to misunderstandings, conflicts, and social withdrawal. Support from loved ones is crucial for individuals coping with mood disorders, yet maintaining these relationships can be challenging. Work and education. The impact of mood disorders on work and education is significant. Individuals may struggle to meet the demands of their job or academic responsibilities, leading to absenteeism, decreased performance, and in some cases, loss of employment or dropping out of school. Accommodations and support from employers and educational institutions can aid in managing these challenges. Physical health. Mood disorders are often associated with poor physical health. Individuals with mood disorders may neglect their physical well-being, leading to conditions such as obesity, cardiovascular disease, and chronic pain. Additionally, the stress and physiological changes associated with mood disorders can exacerbate existing health conditions. 8. Impact on society. Economic costs. Mood disorders impose substantial economic costs on society. These costs include direct expenses, such as healthcare services and medications, and indirect costs, such as lost productivity and absenteeism. The economic burden is further amplified by the need for social services and disability benefits. Public health. From a public health perspective, mood disorders contribute to a significant portion of the global burden of disease. They are associated with increased mortality rates due to suicide and physical health complications. Addressing mood disorders through public health initiatives can improve overall health outcomes and reduce healthcare costs. Social stigma. Social stigma surrounding mood disorders remains a major barrier to seeking treatment and support. Stigmatizing attitudes can lead to discrimination, social isolation, and reluctance to disclose mental health issues. Efforts to reduce stigma through education, advocacy, and awareness campaigns are crucial for promoting mental health and well-being. 9. Case studies. Case Study 1, Major Depressive Disorder. Jane, a 35-year-old woman, has been experiencing persistent sadness, loss of interest in activities, and fatigue for several months. She finds it difficult to concentrate at work and has withdrawn from social activities. Jane's primary care physician conducts a thorough assessment and diagnoses her with major depressive disorder. She begins a combination of cognitive behavioral therapy and medication, which helps her gradually improve her mood and regain her functioning. Case Study 2, Bipolar Disorder. John, a 28-year-old man, experiences episodes of extreme energy and euphoria followed by periods of severe depression. During manic episodes, he engages in risky behaviors and has grandiose ideas. During depressive episodes, he feels hopeless and struggles to get out of bed. After several hospitalizations, John is diagnosed with bipolar I disorder. He receives treatment with mood stabilizers and psychotherapy, which helps him manage his symptoms and achieve stability. Case Study 3, Persistent Depressive Disorder. Mary, a 45-year-old woman, has felt consistently low for as long as she can remember. She functions adequately but feels a pervasive sense of emptiness and hopelessness. After seeking help from a therapist, Mary is diagnosed with persistent depressive disorder. Through long-term psychotherapy and lifestyle changes, Mary learns to manage her symptoms and improve her quality of life. 10. Future directions in research and treatment. Research in mood disorders is continually evolving, with new insights and treatments emerging. Future directions include exploring the genetic and neurobiological underpinnings of mood disorders, developing novel pharmacological treatments, and enhancing psychotherapeutic approaches. Personalized medicine, which tailors treatment to the individual's genetic and biological profile, holds promise for improving outcomes. Additionally, there is a growing emphasis on integrating mental health care into primary care settings and addressing the social determinants of mental health. Public health initiatives aimed at early identification and intervention, reducing stigma, and promoting mental health literacy are essential for improving the overall mental health of populations. 11. Conclusion. Mood disorders are complex and multifaceted conditions that profoundly impact individuals and society. Understanding the various types of mood disorders, their symptoms, causes, and treatments is crucial for effective management and support. While significant progress has been made in the field of mental health, ongoing research and public health efforts are needed to address the challenges posed by mood disorders and improve the lives of those affected. If you enjoyed this video, don't forget to hit that subscribe button and join the Ni655 family. Give us a thumbs up if you liked the content, and make sure to click the bell icon so you never miss an update. Thanks for watching, and stay tuned for more awesome videos.